British Columbia government has rejected a provincial health officer's report backing non-prescribed alternatives to fentanyl. Dr. Bonnie Henry's latest report on the overdose crisis noted efforts centered on drug prohibition have both failed to control access to controlled substances and created the toxic, unregulated drug supply that has killed thousands. BC's mental health and addictions minister says the province does not agree with the recommendation to expand its safer supply program to prevent overdoses. Adam Zivo from the Center for Responsible Drug Policy joined us to explain the report and the responses to it.
Bonnie Henry's report was deeply unscientific, ideologically motivated, and riddled with disinformation. So she essentially argued for drug legalization using non-medical safer supply as a means to achieve that. What non-medical safe supply would mean, it would be providing hard drugs like meth, cocaine, and fentanyl through non-medical channels, which could include retail stores, so selling it like alcohol or cannabis, or providing it to quote unquote compassion clubs, so essentially nonprofit organizations which would purchase these drugs and distribute it to its members. This is grossly irresponsible. There is absolutely no evidence showing that this could benefit people in any way. The report itself actually acknowledges that there is no evidence to support non-medical safer supply. They acknowledge that there is very little literature that explores these kinds of models, which is very understandable because no other jurisdiction would touch anything like this because it is genuinely insane. All of the information that supports non-medical safer supply is theoretical. And what Bonnie Henry tried to do is she tried to use shoddy extrapolations and conjecture to build a case for non-medical safer supply using the already deeply flawed evidence base for medical safe supply. So she overstated how much evidence supports safer supply, the current form where you have to get it through prescription. She misrepresented certain studies and claimed that this showed that safer supply works when those studies are deeply flawed and unreliable. And just generally just misstated the case here. Many of the foundational assumptions used in Bonnie Henry's report are highly questionable. She argues, for example, that drug prohibition is based in white supremacy and colonialism. And not to be mean, but this argument is just really idiotic. The underlying rationale for that position is that 100 years ago, Canada's first drug prohibition laws were made in response to concerns about Chinese immigrants and their use of opium. But to say that just because drug prohibition was used in a racist way 100 years ago, that it is racist in all cases, I mean, that's kindergarten level logic. And it ignores how racialized communities, both historically and today, have fought to contain the influence of drugs and to prohibit drugs, whether that be China in the 1800s, fighting an actual war with the British to try to seal off opium from its people, or whether it be highly restrictive drug laws in East and Southeast Asia today, which apparently Bonnie Henry's team just, would like to pretend don't exist. The non-medical safer supply system is the fact that Bonnie Henry is advocating for the non-medical safer supply system should not be a shock to anyone who has been following this policy debate closely. Dr. Bonnie Henry has been advocating for this for quite some time. And though it is grossly irresponsible, it is in line with the ideological approach that she has taken to her job. The BC NDP has tried to distance itself from Dr. Bonnie Henry, and they have said that they don't support the findings of this report. But at the same time, actions speak louder than words. They've been aware of her position for over a year, and yet they have kept her in her job and continued to fund a large amounts of really bad ideologically motivated research supporting this, or rather attempting to support this non-medical safer supply experiment.